Good evening, everyone. Hope everyone is doing well. My name is Cecily Mayart Cruz, UTLA president, and I'm happy to present to you our webinar on community health and metrics and a bargaining update. I will introduce the folks on the panel in just a few minutes, but I want to tell you a couple of things, housekeeping items, if you will. First, we have some dynamic folks here assisting with ASL, and we have Justin and Sharon. And so if you need to pin either Justin or Sharon for ASL, that's what you're going to do. And then I believe there's closed captioning also. This webinar is being recorded, so you will be able to use this with your faculties after this webinar concludes. So you will also, thank you, Stephanie. You will also be able to submit questions, just letting you know that the chat function is disabled. We don't want to distract the presenters as we're going along, but we are going to stop at specific points for questions and answers. So this is what you're going to do when you submit your question. Please list your name, your school, your question. I'm going to mention that this right now is going to be a condensed section. Now, after each section, we will take questions. Try to keep your questions germane to the topics that we will be discussing. And obviously, this PowerPoint will be available for chapter leaders for you to use in your chapter meetings this coming week. There's going to be 2 sections for the questions and answers. So I'm going to go to the second slide. And I'm not sure if I see it, but I'm sure it's there. And so we're going to have the process and timeline by our Madam Secretary and she is our bargaining co-chair, Arlene Inoue. We're going to have science-based community health metrics for a safe return by our research director, Grace Regalano. We will then take questions and answers about the health metrics. Then we will go into a required safety elements of a bargaining agreement for a potential physical return by our elementary vice president, Gloria Martinez. We will then go into another round of questions and answers about the elements of a bargaining agreement. And then we will have our wrap up with our executive director, Jeff Good. So again, a couple of things for folks just coming in. The chat function is disabled. You will go to Q&A to answer questions. You will actually have your questions answered. You will type your name, your school, and your question. Try to keep it germane to the topics that we are covering. And that's how that flow will be. We have ASL translation from Justin and Sharon, and all you will do is pin Justin or Sharon so that you can get full access of this webinar. And I am handing it over now to our Madam Secretary and co-chair of our bargaining team, Miss Arlene Inoue. Thank you.
Thank you so much, Cecily. We've been living through this pandemic for the past 8 months, a pandemic that affects our emotional, our physical, and mental state every single day. And throughout this time, the bargaining team has been engaged in bargaining. One could even call it the COVID-19 bargaining cycle. And like many bargaining teams across the state and nation, we've been navigating the terms and conditions of employment during a pandemic with safety as our first priority with life and death consequences before us, and with workload and working conditions as a major concern. UTLA's bargaining team includes rank and file elected representatives from all areas of UTLA and special categories. Our bargaining team members, you can see them pictured here, are Victoria Casas from Valley East, Javi Romo, Valley West, Rosa Jimenez from North, Jennifer Valario, West, Stacy Webster, Central, Adrian Tamayo, East, Cynthia Matthews, South, Jen McAfee, Harbor, Mallory Evans, our special categories rep, and Gloria Martinez, elementary vice president, Julie Van Winkle, secondary vice president, Grace Regulano, our research and analytics director, and Jeff Good, our executive director. Today, we have 6 of our bargaining team members ready to help answer questions behind the scenes. Jen, Cynthia, Javi, Victoria, Jennifer, and Stacy, thank you for that. From the beginning of the bargaining process, we've been consistently meeting with members in chapter-based school and citywide Zoom meetings, constantly engaging in the process to get feedback on possible schedule concepts, safety concerns, and other working conditions. Thousands of members participated in the survey where they provided our bargaining team with very helpful feedback on these issues. And we've been engaged with parents and community partners on family concerns about it, what a safe and equitable return to school looks like. And that includes our community of partners at Reclaim Our Schools LA, and also a parent survey. Bargaining involves ongoing feedback throughout the process until it culminates in a ratification agreement voted on by members. Next slide. So as a summary, the following is the bargaining that we've been engaged in since March 2020. We've bargained side letters, or MOUs. That means Memorandum of Understanding. It means that in addition to our UTLA LAUSD collective bargaining agreement, since our contract doesn't have language about working during a pandemic, that we have these additional side letters. They cover the specific conditions that we are facing now, and they have a specified time frame. They are all up on our website. As you remember, 8 months ago, March 2020, UTLA called for school closures to protect our communities. The next day, LAUSD called for the shutdown of schools. In April, we bargained the terms and conditions during a pandemic and a school closure side letter. In August, after doing distance learning for several months, we bargained a side letter on distance learning for the current school year within the state requirements of SB 98. Then, from September to November, we bargained all voluntary in-person service side letters for special needs. This includes nurses giving the COVID-19 tests, one-on-one assessments and designated SPED services, small groups of students receiving tutoring, early education, specific hands-on adult ed training programs, and outside physical conditioning for athletic programs. Again, these are all voluntary programs that we negotiated the safety and working conditions for. At this time, right now, we are discussing with the district the terms and conditions for a potential return to physical schools, a potential return. And I'm saying this as COVID-19 rates are surging in LA, in California, and across the nation. So you may be wondering, why are we even bargaining? Let me be clear. LA's leaders and residents have not done what's needed to bring the virus under control. So our students cannot safely return to school now or in the near future. They cannot return to school now, nor soon. That being said, we believe we need to bargain for what an eventual physical return to school would look like, while recognizing that we're nowhere close to that safe physical return. So the obvious questions: why bargain? What is our purpose? And what is our goal? Why bargain? Number one, we have a legal and ethical obligation to our members to bargain on what a physical return eventually looks like for our students and our members. If we do not bargain, the district will be in a position to unilaterally impose their own version of what a physical return looks like when such a return becomes safe. Two, students learn best in classrooms with their peers and teachers. Nothing replaces the in-person teaching and learning dynamic between an educator and their students. We want to ensure that a model for physical return maximizes student learning and is safe for everyone. Our students need to be back in physical schools. Our teachers and educators long to be face-to-face with their students. And our students are missing their peers. But we believe this must happen only when it is safe. What's our purpose? Our purpose is to build a plan where we're ready to show elected leaders and our community that students and educators want to return, but only when those same elected officials have enacted the right policies and provided the necessary funding to make it safe to return to school. What is our goal? Our goal is to keep our students and community safe and to continue teaching them during this unprecedented crisis. And we want to create the conditions that make it safe to return to school. So when will it be safe? And what are the metrics used to determine safety? Grace Regulano will now walk us through the metrics for a safe return to schools.
Sorry. So first of all, I just wanted to make it clear that it didn't have to be this way. In California, as of Sunday, there were over 1 million COVID-19 cases with 18,262 deaths. About 40% of those deaths, over 7,000 people gone, many of them dying alone in a hospital bed, are from LA County, despite LA County only accounting for a quarter of the state's population. And I want to remind you all that reporting on positive tests and deaths tends to lag over the weekend. So the numbers you're seeing right now here are almost certainly understated. So what you see here are just a handful of the countries that have done a better job managing this pandemic than California and Los Angeles. Look on the left-hand side. Indonesia, the fourth most populous country with nearly 7 times as many people, has had fewer deaths than California. Same with Germany. Same with Canada. And when we look just at LA County, the entire countries of Pakistan, Bangladesh, and China have all had fewer COVID-19 deaths than the county of Los Angeles. It's clear that something is terribly wrong with our pandemic response, not just at the federal level, but at the state and local levels as well. The good news is that we can quantify what the number of lives we saved were by taking concrete, quick, decisive action in March. Even as it was becoming clear that this pandemic would ravage our communities, our state and local governments were not taking decisive action. The member leaders of this union, you all here today, took a strong stance back in March and called for schools to close. Our decisive calls for action saved lives then, and our calls for action now will continue to save lives. A study was published in the respected Journal of the American Medical Association estimating that in just 16 days, closing schools saved 40,600 lives and resulted in 1.37 million fewer cases of COVID-19. Now, some elected leaders would have us believe that they are making a tough choice between saving lives and saving jobs. But that's a false choice. Countries which suffered the most severe economic downturns are the countries with the highest death rates. Countries where the economic impact has been modest, like Taiwan and South Korea, kept the death rate low. Here's what the World Health Organization has to say. We do not need to choose between lives and livelihoods or between health and the economy. That's a false choice. On the contrary, the pandemic is a reminder that health and the economy are inseparable. And this makes sense intuitively. I have friends in Taiwan. On their social media, they're posting photos of themselves out at coffee shops, restaurants, shopping malls. Taiwan has reopened and their economy is recovering because they have done a better job of managing the public health crisis. And it is the public health crisis which caused the economic crisis. And we must never lose sight of that. So all this is to say that the death and illness that we see all around us is not inevitable. The virus does not create the pandemic. People and politicians create the pandemic. The crisis comes from the lack of leadership. So let's talk about how our elected leaders in California measure safety and why it's not enough. The state's blueprint for a safer economy only takes into consideration the level of viral spread. They use these three indicators or metrics: daily new cases, how many new cases per 100,000 residents are confirmed daily; test positivity, does a percentage of positive tests indicate that COVID testing is widespread enough to identify new cases; and the health equity quartile, what is the level of viral spread in the most at-risk communities. But most public health experts look at more than just the level of viral spread to assess risk during an active pandemic, especially as they reopen more sectors of society. So this is one thing that we want to add that as a key community health indicator is the infection rate. Is the number of infections going down or is it going up? The R0 rate, the transmission rate, is not one of the metrics that the state or county currently uses to decide when it's safe to reopen schools or other parts of society. And access. Can people in testing and capacity and efficacy? We have to know not just how widespread the virus is, but we have to know whether our testing programs have the capacity and are running efficiently enough to tell us where the positive cases are. Can people get tested quickly, regardless of symptoms and ability to pay? And are test results available quickly enough to act on? If you all recall, at the start of the pandemic, sometimes test results took 5, 10, or even 2 weeks to come around. When the median incubation period of this virus is 5 days, that is far too long. So that's what we mean by testing capacity and efficacy. Can people get tested quickly, and are their test results available quickly enough to act on? And then finally, tracing, contact tracing, which fundamentally means, are we finding and isolating most new cases before COVID-19 spreads? So we need to know these community health indicators, not just the level of viral spread or how much virus is in the community, but we need to know with testing capacity and efficacy where the virus is, and with tracing capacity and efficacy, we need to know if we're finding and isolating new cases before the COVID virus spreads even further. So many of you all remember our most recent survey. Over 80% of members said that they did not want to yo-yo. In other words, if it looked likely that outbreaks would lead to schools having to shut down again shortly after reopening, members overwhelmingly wanted to stay in distance learning until it was safe to reopen. Our students, our communities need consistency, not a whiplash yo-yo effect. What you see here is the positivity rates in daily cases per 100,000 where the state of California says it's safe to reopen schools, the red tier. Right now, LA County is in the purple tier. This is UTLA's science-based community health principles for those same metrics. You can see how much lower the positivity rate is in our science-based community health principles. And this is where several other countries and cities' metrics were when they reopened schools on a wide scale. So let's notice how almost every single one is lower than either the California red tier. Let's take a closer look at Israel. Israel had less than 50 new cases per day when it decided to reopen on May 3rd. A month later, by June 3rd, schools were closed again after 2,025 students and staff were infected, with 28,147 students placed under quarantine. But let's take a look at South Korea, which in many ways is a model of pandemic control thanks to its rigorous testing, tracing, and quarantine program. Look at how low their daily cases per 100,000 and their positivity rates were when they reopened schools on a wide scale. Despite this, more than 500 schools had to close again shortly after reopening after a new COVID cluster was identified. So this is why we believe that we need to look at more than just those metrics that the California Blueprint for a Safer Economy looks at. I want to be clear that UTLA's position is, and always has been, that educators want to return to classrooms with their students as soon as it's safe. You heard Arlene talk about that. We know, and other countries have shown, that it is possible to reopen schools safely when there is low community transmission and when the proper infection control protocols are funded and followed. And let's be clear that although thankfully, children, especially those under 12, seem to be less likely to be infected, they absolutely still can get infected, can transmit, and can die of COVID. My dad is a pediatrician and has seen children admitted to Children's Hospital with MISC-C. And because this is a novel coronavirus, a new virus, we're still trying to understand the long-term damage that both adults and children might have to deal with when they do survive an infection. This is the difference between morbidity and mortality. Although understandably, we've been focused on mortality or death rates, the morbidity or the long-term effects are coming into sight, and they are not looking good with this novel coronavirus. Even the CDC, which unfortunately has been tainted by the Trump administration, says that low community transmission is necessary to safe reopening of schools. And even the CDC says that there is a growing body of evidence that children of all ages are susceptible to infection and do play a role in transmission. So one of the things we want to do is be very clear about what we mean by as soon as it's safe. So let me go over that. I'm going to now walk through UTLA's science-based community health metrics for a safe return. Science may change and may inform us that elements of this may need to change. But right now, this is what science tells us is a gold standard, and we want to start at the gold standard. These metrics were in large part informed by the Harvard Global Health Institute, benchmarked against California's Blueprint for a Safer Economy, and also benchmarked against other countries that have done a better job of pandemic control. So first of all, the level of virus spread within LA County, as well as each of the surrounding counties where our students and employees may live. One, there must be less than 7 daily new cases per 100,000 people. B, the positive test ratio must be 3% or less. C, the health equity quartile census tracts test positivity rate must also be 3% or less. I'll go into a little bit more detail on that in a minute. And the R0 or transmission rate must be less than 1, meaning that the virus is declining rather than spreading further. So a little note about the health equity quartile. The health equity quartile measures the equity impacts of this pandemic on highly impacted communities. As we know, this pandemic has combined with the deeply ingrained structural racism and classism of this country, resulting in disproportionately high infection and death rates for our communities of color, especially Black, Latino, and Pacific Islander communities here in LA County and communities dealing with poverty. Many of our school communities have been disproportionately impacted by COVID. A supermajority of our students are students of color living in poverty, and many of our members of our educators are teachers and educators of color. The HPI census tracts metric means that these highly impacted communities, for example, the communities living along the 110 corridor, must also have a test positivity rate of 3% or less before we think it's safe to reopen. In other words, the disproportionality must be evened out before we feel that it is safe and equitable to reopen LAUSD schools. And as a reminder, the state and counties requirements are based simply on daily new cases and positive test ratio. They don't even consider the R0. So testing. Testing and tracing work together sort of like firefighting. Testing tells you where the fires are, and you need to know this in a timely manner. Tracing tells you whether or not you have the ability to put out the fires that you know exist before they can become an inferno. Sorry, you guys, my office is next to my front door. Remember that the state does not take into consideration testing and tracing capacity and efficacy when it decides what can reopen. It only takes into consideration viral spread. This is sort of like being in fire season, knowing how many fires you have, but not having any real idea exactly where those fires are or how many firefighters you have available to fight those fires. So testing. Anyone must be able to access a test regardless of symptoms or ability to pay. We know the asymptomatic transmission rate of this disease and be able to get tested within 24 hours to 48 hours. I'm really sorry, you guys. I'm going to ignore that. Until easy access to testing and rapid return of results is available to all, it would not be safe to return to schools. And with currently available technology, test turnaround time should be less than 48 hours for standard RT-PCR and from 15 to 45 minutes for point of care or antigen tests. Although just a note on antigen tests, the false positive and false negative rates of those, as we are seeing more of the results, are becoming increasingly concerning. So this is a novel coronavirus. So as I said before, this is what we currently think based on science is a gold standard. However, of the metrics I'm showing, we probably have the least clarity about what the exact gold standard is for contact tracing capacity and efficacy. For example, you're going to have very different success with index cases giving context when you're tracing a sexually transmitted disease than when you're tracing tuberculosis. But the point is, we need to have some sort of measurement on tracing capacity and efficacy because all three work together to control the pandemic. Just a note, currently, the County Department of Public Health's contact rate is only between 50 to 66%. That means that at least 1/3 of infected people are not giving information about their contacts. So let me walk through this. In terms of contact tracing, we need to know, 1, do we have the necessary number of contact tracers given population viral spread to be able to stay ahead of the virus? 2, are enough infected people or index cases giving information about their contacts so that we can notify people before they spread the virus further? 3, we're saying that the trace time must be 24 hours or less, and the time from contact tracing program to test of contact must be 24 hours of less. This lessens the window that people are out there in the community potentially spreading the virus. 4, are contact tracers able to get in touch with almost all of the contacts that infected people tell them about? As I mentioned, the contact rate in LA County right now is only about 50 to 66%. Once contacts are found, are almost all of them being monitored, quarantined, or isolated as needed? And then finally, F, and this is important because of the decentralized nature of testing and tracing in LA County, is the tracing program working effectively with the tracing program and identifying infected people before they develop symptoms? I want to talk a little bit about this. Obviously, there's been some issues raised around LAUSD's testing program. For example, the LA Times article about concerns about Summer Bio, the startup company. But we have to give credit where credit is due. LAUSD is building an ambitious testing program because the county and state have made it clear that they're not going to step up to the task. And we need a robust testing program if we're going to open over 900 schools in LAUSD during a pandemic. So that's what F is about, because in other counties, the testing and the tracing program are centralized with a county. Here, because LAUSD is standing up their own ambitious and robust testing program that UTLA is in close discussions with LAUSD on about concerns about transparency and about efficacy. We are in those conversations. We have to measure how the county program and the district program are working together, and that's what F is about. So these are some, final principles that, we want to share today. If circumstances change, for example, if the science around what's known about transmission changes or if new treatments are available, we would meet again to revisit these principles. And as Arlene said, we are currently meeting to establish plans and protocols for the return. And when these community health metrics are met, we would meet to develop the timeline for the return. And if upon the physical return to in-person instruction, the county level conditions worsen, that the district would return to crisis distance learning. I was surprised to find out that in the California Blueprint for a Safer Economy, once the county moves to the red tier and reopens schools, if it gets demoted, as 11 counties did last week, there is no requirement to shut schools down wholesale again, to shut the district down. So the district and LAUSD have broadly been on the same page about health and safety since the beginning of the pandemic. Despite the growing political pressure to reopen no matter the risk, And no matter the risk to our communities of color and to our communities that are struggling with poverty, that disproportionate risk, despite this growing political pressure from astroturf parent organizations and irresponsible elected officials, the district and UTLA have stood firm that science must guide the timeline for reopening. Now we're in conversations with the district in the hopes of getting them to sign on to a statement of shared principles about this specific science-based rubric for community health metrics for a safe return. The district tells us that they have taken our principles and are currently sharing them with their university health advisors for feedback. So now I'm going to open it up for questions. So let me open it up for questions right now. Okay. Give me one moment, please. So I'm just taking a look here.
I've got a question here, Grace, that I would like to respond to. It's a great question, and thanks everyone for giving us your questions. This is, why is the district holding town halls on reopening protocols when there has been no agreement for reopening? And are they trying to pit us against the parents? So you've probably been getting emails recently and also booklets. You'll be getting email booklets and information about these town halls. And the thing about this is that, remember, LAUSD is very large, the second largest school district in the nation. So it is a huge undertaking to reopen 1,400 schools. And that takes a lot of preparation. They are trying to figure out and find out how many students will be coming back, how much staff they'll be needing. So they want to know about parent interest. And while I can understand it may feel like they are pushing the gas pedal on moving forward, the district has said again and again that safety comes first, that it is only when the conditions are right that we will be reopening schools. So even as they are planning, it doesn't mean that they're reopening schools. It means that they have to have a plan. And yes, we haven't bargained an agreement yet, but we're getting closer. And I think there's some parameters that they are putting forward. So they are having these town halls, and we're going to continue to work with them because safety has to come first.
So I'm seeing a few questions in the Q&A. Thank you for submitting these questions. Several people have asked whether or not they can share this slideshow with your teacher, with your coworkers. Absolutely, your chapter chairs will actually be getting this slideshow via email tonight. And we absolutely encourage and hope that you all will have meetings with your coworkers to discuss these safety principles, to give them this update on bargaining. So absolutely, chapter chairs will be receiving this presentation to share. So you actually don't need to take screenshots because you'll be receiving it shortly, okay? So I'm just going through here. One of the questions is from Adam Gonzalez. Is there an intent to test students for COVID-19 as teachers will be tested when we return? Adam, that is the testing option is actually already available, and folks are already being encouraged. I'm actually the parent of an LAUSD student. We're actually already being encouraged to go to the testing sites, and that's what that's why the testing is robust testing program is so important, especially because children, especially those children under 12, are likely to be asymptomatic carriers. That's why testing is important, because symptom screening alone does not catch COVID-19 folks infected with COVID-19, especially children infected with COVID-19, because they're likely to be asymptomatic or low symptom. So just a note on that. Let me see here what else I've got. Let's see. So let's see here. So Anne Zirin Lee from Aldama Elementary says, LAUSD has not released data on the numbers of school employees, teachers, and students who have tested positive. Their dashboard, so thank you, Anne Zirin Lee. We've UTLA, we have a subcommittee on safety, and we've been pushing them for those numbers. They're working on a dashboard, and we have begun to get some of that information, and we're encouraging them to make that information available publicly. And they said that they will be sending us the website. And so once that website is up, we will absolutely be sharing that information. So let's see. So that's one question. Sorry, the questions are coming in fast, so it's actually hard for me to monitor everything. This is my first time doing a webinar, so thank you for your patience. So let me keep looking over here. So Heather Brown asked, what about schools with no windows and air systems that do not ventilate and clean the air? Heather, that's a very good question, and I want to spend a little bit of time talking about aerosolization and airborne transmission. And actually, Gloria in our next section will also talk a little bit more about that. And so one thing I want to touch on is, you know, over the last month or month and a half, 2 months, the CDC posted, took down, whether or not, you know, information about one day, yes, the virus can be aerosolized, airborne transmission. Another day they took it down. So that one, I wanted to highlight that because it shows exactly what we mean by a novel coronavirus. It's brand new. The science around it is still emerging. And that's why this is what the gold standard is right now. And so there is a concern around aerosolization and ventilation, and that's part of the concern around winter, is as people move indoors, and we're actually seeing this in Europe, and from the outdoors, that transmission increases. And so we've been in conversations and with the district, and Gloria will talk a little bit more about that in the next section, about what, you know, are some of the parameters, some of the safety parameters that will be necessary for a safe return.
Grace, I'm going to take this question here.
Sure.
We're getting a lot of questions about reopening for people with health conditions. So thank you so much for those questions. We have been told by the district that if you are over 65 years of age and if you have an underlying health condition, you know, showing your report, your doctor's record, you will be able to continue with distance learning. For students, they are giving parents a choice of whether you want to continue with distance learning or a hybrid in-person model. So there's that option totally for parents and students. And for members, if you have an underlying health condition or over 65, then again, they said that you will not have to come to schools physically. And I'm sure they will continue to explain those specifics with us.
So one question, this is from Barbara Foster, is suppose that there are some specific neighborhoods with low transmission rates. Could those schools reopen even though schools and high infection rates remain closed? So that's a very interesting question, but and here's what I would have to say is that schools are not bubbles, right? Especially in a district with a lot of busing, especially in a district with a lot of people working, you know, and crossing from one side of the city to another, from the mountains to the valley, right? Like people are still traveling and moving. That would, if one part of LA has high transmission and another part of LA is low transmission, LA has high transmission, right? Because schools are not bubbles, unfortunately. And that's what we're seeing. I don't know if you all saw the information about the wedding that occurred on the East Coast that became a super spreader event. It was less than 50 people attended it. And then that became a super spreader event. And all the people who tested positive and the people who were hospitalized, none of those people actually attended the wedding. And that's why it's so important to have a coordinated response for an entire region. Because, right, you may live in Eagle Rock, but work as an essential worker in Hollywood, right? Your child may go to a school in West LA, right? But maybe they have a backyard, a socially distanced play date that tends up not being socially distanced with a friend from the harbor area. And so that's just something that's why a coordinated response, county level conditions are so important. So let's see. And I'm having a hard time keeping an eye on the time. So folks, please let me know if we should wrap up questions. Okay, so I see several questions here about sort of conditions if and when these metrics are met, and just want to reassure people that Gloria Martinez, our elementary vice president, will be answering some of those questions in the next section. Okay, so I see several questions, so that's why I'm not answering some of those questions right now.
Grace?
Yep.
There are some questions coming up around privacy and notifying your administrator if you do test positive. I don't know if Arlene, Jeff, or yourself would like to answer. What are the protections that our members have?
Arlene or Jeff, do you want me to take this, or do you all want to take it? Yeah. Okay. So this will all fall under HIPAA. The medical privacy laws, right? And so that is one of the things, that's why contact tracing is so important, is because you have to do that contact tracing while also keeping people reassured and absolutely respecting that medical privacy. And so that reporting would have to happen in a way that does not identify the individual, while also being able to get in touch with that person's close contacts in order to get in touch with the tracing. And so you can see why a rigorous contact tracing program with highly trained individuals is so important, because privacy has to be maintained. There are laws around it, while at the same time making sure that we are moving fast enough in contact tracing to firefight before it becomes an inferno. So that's a really, really good question. And it highlights the complexity and importance of highly trained and efficient contact tracing program. Are there other questions? Okay, can you discuss Bruce Wright has a question about, can you discuss the R0 rate a little bit more? Sure. So the R0 rate is also known as a transmission rate, and is a measure of how many people an infected person infects. And so if it's greater than 1, so like if I'm infected and I infect, and the average infected person infects 2 more people, your R0 is 2. That's what, and that's how you have exponential spread. And so when the R0 is greater than 1, that means that the virus is spreading and increasing in the community. When the R0 is below 1, that means that the virus is slowing its spread, and if that trend continues, will eventually die out on its own. Over the last several weeks and months, the LA County's R0 transmission rate has almost always been at 1 or slightly above 1, meaning that we have not actually succeeded at suppressing or shrinking the virus. It's either maintaining or growing in its scope. And as we've seen in the last few weeks, it's definitely growing in scope. So that was, thank you for that question. Okay, so let's see. I think I see several questions about vaccines. Is that right? I see a few questions about vaccines. Maybe I'll sort of answer that generally. A lot of people are saying, like, we know a vaccine is coming. How's that affecting everything? So first of all, really want to acknowledge just the incredibly good news about the Pfizer and the Moderna vaccine. For those of you who don't know, 90% and like 93% efficacy rate, which is like way higher than most public health experts were expecting. However, those are the preliminary results. There's still a lot of questions outstanding. And in terms of mass manufacture, distribution, then so first you have to actually manufacture enough. They're both 2-dose vaccines. Then you have to have a logistics pipeline to distribute it, because I believe they both require a cold chain. Definitely the Pfizer requires a cold chain. I forget about Moderna. Then you're gonna have to actually convince people to inoculate. There's a lot of vaccine hesitancy, especially from our most impacted communities, like African-American communities, due to the unfortunate history of medical racism that some of our impacted communities are facing. So for example, during the H1N1 scare, the African-American communities in LA actually participated in vaccination programs at a far lower rate. So you have to overcome a lot of logistical things, a lot of cultural things, and then you have to, in order for all that to happen. And that's even assuming that everything goes well, and the efficacy length of time is good and all of that stuff, right? And then as of last week, it may have changed since then. As of last week, I believe that only one of the trials had children in it, and I believe none of the trials, although don't quote me on that, I have to look at it again, I don't have it in my notes. I don't recall whether any of the trials had children below 16 in them either. And then once the vaccine is available, much of the talk right now is around first essential workers, especially hospital workers, being first in line to receive the vaccine. So all of that is to say that there's some really good news, but I think it would be quite a stretch to say that a vaccine is right around the corner, because there's still a lot of stuff between now and then. And unfortunately, with Trump refusing to provide a transition of power right now, that's actually one of the major impediments to a broad-based vaccination program. It's actually putting the vaccine, mass vaccination inoculation program further and further away, because the Trump administration is refusing to help the Biden administration with the transition. So that's, unfortunately, yet another casualty on top of the 200,000 casualties that the Trump administration is responsible for. Let's see. Are there other questions that folks want me to answer? I'm having hard, they keep coming. So if there are other questions that folks think I should answer, otherwise we may want to, we have like, let's see.
We do have another time for Q&A as well, so.
Yeah, okay,
Yeah.
So should we move on then? I'll reshare my screen. Yeah. Okay, great. So I'm gonna reshare my screen. Thank you, everybody, hope that helped. Give me just 1 second, please. And so I'm going to pass it on to Gloria, our elementary vice president, to talk about the next section.
Oh, thank you so much, Grace. Okay, so before we get into this section, I want to remind everybody why we're bargaining, what's the purpose, and what our goal is. This slide might look familiar because Arlene reviewed it earlier. Why we bargain. First of all, we have a legal and ethical obligation to our members to bargain on what an eventual physical return looks like for our students and members when such a return becomes safe. Students learn best in classrooms with their peers and teachers, and we want to ensure that a model for a physical return maximizes student learning while never losing sight of safety. What is our purpose? We want to build a plan to show elected leaders and our community that students and educators want to return, but only when those same elected leaders have enacted the right policies and provided the necessary funding to make it safe to return to school. So I want to remind folks, because that is a very popular question. It is only when they have provided the necessary funding and resources to make it safe to return to schools. And what is our goal? Our goal is to keep our students and communities safe and continue teaching them during this unprecedented crisis, and to create the conditions that make it safe to return to school. Okay, next one, please, Grace. Now let's review what are the required safety and pedagogy elements of a bargaining agreement for a potential physical return. What you see in front of you are what we see are required safety elements of a bargaining agreement for a potential physical return. A lot of these came from conversations that we've had with many of you and our leaders across the city. First of all, we want to avoid the 3 C's: closed spaces, crowded places, or close contact settings. Universal mask wearing, except for children younger than 2, anyone who is incapacitated or otherwise unable to remove the mask without assistance. Face shields are not recommended as a substitute for masks because of a lack of evidence for their effectiveness to control the spread of the virus from source to source control. We want to make sure we can maintain stable student cohorts. We must avoid mixing freely between classes and activities. Do not mix groups throughout or across school days. Students, teachers, and staff are required to follow steps to protect themselves and others through proper use of face masks, social distancing, and hand hygiene. no sharing of objects between students and teachers, robust testing program. This does not obviate the need for infection control, working in conjunction with a robust tracing program. Staff and students must stay home if they are showing COVID-19 symptoms. Staff and students who have recently had close contact with a person with COVID-19 should stay home and monitor their health. Proper operating ventilation systems. This was a question that folks asked earlier. And regular cleaning and disinfection of frequently touched areas, implemented with fidelity. Any model of a physical return to school must take into account all these factors, so you can see how complicated this really is. In addition, we will fight for COVID Health and Safety Committee comprised of all stakeholders, all stakeholder groups at every work site. At least 1 week of professional development and preparation for all staff specific to every work site prior to implementing a physical return of students. Extensive parent and student education and preparation specific to every work site prior to implementing a physical return of students. Explicit leave rights and language addressing working condition impacts for all bargaining unit members. Accommodations for bargaining unit members with families with students unable or unwilling to physically return. And structures to support special education students and HHS and DIS service providers. The safety requirements we outlined will create safer learning environments for our students, communities, and members. We must also fight for schedules that make sense pedagogically. Here are some of our goals. Ensure safety by not having 2 cohorts of students in 1 classroom on the same day. No AM/PM elementary school model. Ensure safety by limiting student and their classroom movement, roving. Ensure class quality teaching and learning by not requiring simultaneous in-person Zoom teaching. Ensure quality teaching and learning by allowing enough time for subject matter engagement, give the incursion into instructional time by the required safety protocols. And ensure continuity and stability for our students by limiting the disruption to master schedules. Given all the safety requirements that we just outlined, you can see how complicated this endeavor is and why we are bargaining over these issues now, even though a return to person instruction is in no way imminent. We are putting in the time now to think through these complex safety and pedagogical factors so that when it is safe for students and educators to return to our schools, we are ready to do so. And now I invite our secondary vice president, Julie Van Winkle, our executive director, Jeff Good, and others on the bargaining team to join us to answer some questions. Okay. So
I do just want to jump in. I'm noticing I'm trying to answer the questions, and I know that there's a lot we haven't gotten to yet. There's a lot of questions about, what if you're 60? What if you're 65? What if you have an underlying condition? What if you have a relative that you live with who has an underlying condition? The bargaining team we've been thinking a lot about this, and we've been talking to the district about, we don't have an agreement yet, but it is very much on our radar. So I wanted to let you know there's nothing set in stone about that, but we are very aware that we're going to have, accommodations for people who are in high risk groups. And we're aware that many of our members live with people who are in high risk groups.
Okay, thank you, Julie.
Gloria, can I add to what Julie just shared?
Yes, please.
One of the things that's happening is that the district is going to start surveying families, as many of you know, and then at a certain point, they're going to have to survey our members as well for who is willing to return and who is not willing to return, who is able to return, who's got health factors that would prevent it. What we don't know yet is whether those numbers match, whether the number of families who choose to stay remote will match with the number of educators who choose to stay remote. We will be able to negotiate accommodations for folks who have those underlying health risk factors that Arlene said, and the district is committed to honoring that. And so that is something that we will be able to bargain, as Julie said, and we'll continue to bargain. Now, if the number of, to be blunt, if the number of families choosing to stay remote is less than the number of educators choosing to stay remote, there is no guarantee that people without underlying health conditions would be able to stay remote in that situation. But that will be an ongoing part of the bargaining process.
Great, thank you, Jeff. And I do see some questions regarding special education and dual language programs. And I just want to state that, you know, there are a lot of unique schedules that we have to take into consideration, but the bargaining team felt it was very necessary to look at what is a possible schedule. What would it look like to begin with? What would our day look like? And then discuss with the district all of the different unique opportunities that our schools offer. So those will come once we have something that we have a base to build on. Julie, I don't know if you want to add anything to that. I think we're, so folks.
I'm sorry, I was answering a question at the time.
No worries. And then in regards to special education and delivery of service, we do understand that your caseloads, right, are throughout different schools. And, you know, often if you're not at various schools, it's through various classrooms. So we're looking into ways to minimize that so that you are not exposed at a greater rate. A lot of our services, you know, we've heard from folks that a lot of our services can continue to be delivered virtually. So these are all, again, our co-located sites, our dual language sites, our schools that are doing inclusion at this moment, and other, you know, wonderful like and unique programs offered throughout the city. Those are all, you know, ones that are going to have to be developed and discussed once we get a schedule that we can work off of.
So one question I'm seeing several times is a question about compliance, right? What happens if a student refuses to wear a mask? What happens if parents send their kid to school sick? They dose them up with Tylenol. We've all seen that happen. So that's a question that keeps coming up. Gloria, Arlene, do you want to answer, or Julie, do you want to answer that question, or do you want me to, Jeff?
Go ahead, Arlene or Grace. Sorry, I was looking.
I've been answering questions too.
We're terrible at it.
Sure. So,
okay, go ahead.
Go ahead, Jeff.
I just said that's going to be that's one of the main lanes of bargaining. I mean, one of the challenges with what we can bargain and what we are going to try to bargain is, you know, as close to airtight safety procedures and protocols as possible, covering the full breadth. But there's no getting around the fact that you got over 900 school sites in this district. And compliance is also going to be an organizing issue. As Gloria indicated, that one part of an agreement will have to include safety committees with stakeholders from all employee groups, parents, and also in secondary, probably students. But organizing around safety issues in terms of compliance will be essential. The sheer breadth and scope of the district will require that. Even if we bargain the perfect language to create a hermetically sealed school site, there's going to be, once they open in that eventual case, then there will still be a day-to-day operation where we're all going to have to be vigilant and make sure that the district is vigilant.
Yeah, and then in relation to compliance, just to kind of summarize some of the things that the district is doing, you know, they're going to have a Microsoft app, so they can have, you check on basic health and safety symptoms. They're also going to have health and safety protocols at the school site, including social distancing, you know, the small learning pods, PPE equipment, the change filters, and the electrostatic cleaning every day, and the disinfecting at least 2 times every day. This is what the district has been working towards and moving towards. In addition, like as Grace stated, the importance of a testing and contact tracing, or community engagement as it's called in LA Unified, is critical. They're all critical components of how to keep schools safe. And then we're getting questions about what happens if someone tests positive. And in that situation, the school, the principal would be notified. Again, there's privacy information so that they're not going to put the name out there, but the principal will know who it is. And then also they will be able to make contact with the people at the school. The school will be notified and the people who work at the school. And there will be a public dashboard that has every single school on it and the incidences of infection rates and so forth. So the district is moving like in all of these various ways to try to address the safety and health conditions that impact our students.
So I'm seeing several questions about symptom screening. So I'm just gonna, if it's okay, I'm just gonna answer that just because I saw a handful of questions about that. So symptom screening is important. And that is gonna work in conjunction with the app that Arlene just talked about. However, this is why low community spread is so important in the conversation about reopening schools. This is because children, especially children under 12, are far more likely to be asymptomatic or low symptom carriers of the virus than adults. So some public health experts, actually think that like symptom screening, if a hyper focus on symptom screening converge on like pandemic theater when it comes to children because of the high rates of asymptomatic transmission. So again, symptom screening is important. It's going to work in conjunction with the app that Arlene just mentioned. But what will keep us safe upon reopening schools, prevent outbreaks, prevent the yo-yo, is low community transmission in the broader community because of the asymptomatic presentation of COVID in children. So hope that helps with that question. I'm also seeing some questions about PPE for different job categories. Arlene, do you want to take that, or Jeff, or anybody?
Sure, we're in the process of still talking to the district about the specific job categories and the kind of PPE that's needed. So for example, for my speech and language folks out there, we know, like the mask where you can see the mouth and you will be able to work by seeing, the speech, or the PPE equipment that audiologists need for the testing room. Or we know we have very young children that are even younger that are 2 and younger. And what do you do when they, they're not wearing masks, right? So there's tons of questions about what will be safe for the different workers in our profession. And so that is still being in process of getting, we are pressing the district to be very specific in what they're going to supply for each of our professionals.
And they can see examples of that on our website through the volunteer side letters that we have bargained so far. This is only for folks who are volunteering for like the small group tutoring or the in-person assessments. There are on our websites, utla.net, the examples of some of the PPE that we are asking for.
I also just wanted to jump in. I'm seeing a lot of questions about, will we be required to be doing simultaneous in-person instruction and Zooming? How will pull-out groups work? How will 50-50 dual language instruction work? I just want to let people know that we are bargaining on the scheduling. We've heard loud and clear that people are concerned about doing the simultaneous in-person instruction and Zooming, and we're pushing against that. What we're trying to do is come to some agreement about a general schedule and then start thinking about how it could work for, for more specific situations like dual language or pull out RSP. We are very aware, our main priority is to come up with a plan that would be as safe as possible. So, we definitely, I think the district and we are in agreement that we don't want to have students moving from class to class. We want to have discrete cohorts. we're trying to, we're very mindful of teachers coming into contact with a bunch of different students too. So I just want everybody to know, while there's still a lot being worked out and we don't have specific answers about exactly how schedules will look, it is very much on our radar that we want to prioritize safety and have discrete cohorts. And we understand that there are a lot of unique programs. And that's why our bargaining team does contain rank and file members from all different areas. That contains itinerants, special education teachers. So these are all things that are on our radar, but thank you for bringing it up in the chat. And if there are ongoing questions that you might not get an answer to, I would encourage you to reach out to your area board of directors team or your bargaining team representative in your area in case we're not able to answer all your questions, because seeing all the open questions, I'm not sure that everybody will get an answer.
Gloria?
Go ahead. I was just going to hand it over to you, Jeff.
Oh, okay.
Yeah.
Thank you. Two things. There are a lot of questions about the vaccine, as if there is one, because right now there isn't one. There are only a couple of test trials that have been leave us optimistic, all of us optimistic, but the reality is that we don't know, we don't have the answers to most of these questions as it relates to the vaccines. The Board of Supervisors has started talking about the possibility of schools being vaccine centers for a lot of reasons, parking space, room for lines, things like that. But we don't have a lot of information as it relates to that right now. The other thing, when there was a question about when there's a return, how to kind of prep educators, members, students, parents for what that looks like. And so as Gloria talked about earlier, in terms of an essential element of any kind of physical return agreement, there would need to be an extensive period of professional development where we are literally told the district there's going to need to be time and space for everybody who works with us to walk from the northern tip to the southern tip to the eastern tip to the western tip in terms of protocols and procedures and space, all those pieces. And there also has to be extensive education for parents and students to make sure that everybody knows what the expectations are, what the protocols are, and what the procedures are. And then that will then feed to what I was talking about earlier, which is at the end of the day, outside of the county health department, which will definitely play a role and can shut down a school after it's open. There won't be COVID police on these campuses, but what there will be are youth members who can work together to identify where problems are at and working together to organize to make sure that the district meets the protocols and procedures that we bargain.
So I'm told that there's a question in the chat. I can't find it, so I'm sorry, I can't read it aloud exactly, about distrust among certain communities around the vaccine. So I apologize if that was you asking the question. I can't read it specifically because questions growing so quickly, but I do want to talk a little bit about that. I actually had the opportunity and privilege to talk with some parent and community groups, and that question came up from two African-American moms. We have to acknowledge the history of medical racism in this country that leads in some ways to an understandable mistrust of the medical community in some of our communities, right? And it's really unfortunate that because of racism, those same communities that have a higher level of mistrust are unfortunately also the same communities that are experiencing higher infection and death rates across the country. There's a statistic out there that I believe that 1 in 3 or 1 in 4 African Americans in the United States know somebody personally who has died of COVID-19. As a Filipino American, many Filipino Americans also know, we unfortunately also know folks personally because of just the number of folks who are on the front lines as healthcare workers, for example. So that's something that we have to talk about, and that's something that has to be at the forefront, because we have to talk about opening schools not just safely, but equitably. So there has to be a greater amount of outreach to these heavily impacted communities. That's why you'll notice in our community health metrics, there is this focus on equity with a health equity quartile. There was a lot of questions in the chat around, well, I go home, I don't have a health condition, but I go home to somebody who does. In LA County, which has some of the worst housing and most crowded housing conditions, right? that's a real concern. And especially with recent science showing, you know, up to a 50% transmission rate within a household, let's think about what that transmission rate in a household looks like in some of our most impacted communities. Think about MacArthur Park, where there's families of 4, 5, 6 people living in a 1-bedroom, right? There's families living in converted garages. And so absolutely, you know, we have to have at top of mind all the different ways that structural racism, that medical racism, and structural classism have impacted our communities and are going to impact our school communities. And that's why low community transmission, a focus on equity, a focus on our most impacted communities, and a focus on education. You'll notice that one of the things that Gloria highlighted was parent education. One of the things that we've been pushing the district on, for example, is making sure that those materials are translated into every single language spoken in the district, right? So the burden does not fall on our students to translate for their families. Really glad that somebody asked that question. We have to keep in mind our most impacted communities, because these are our school communities. Up the outreach there, and focus on equity and lowering the community transmission, so that when we reopen, when it's safe to reopen, it's not Black and Brown communities that are suffering the most.
I wanted to take this question. Several people have asked about itinerants, whether you're a nurse or psychologist or arts educator. There's so many, we have so many members who have multiple schools. And what will that situation look like? That is really a good question. And that is something that we are talking about with the district. We have raised to them that members who have many students, like some of you have, you know, 40, 50, 60 to over 100 students right now on your caseload, or you have multiple schools, more than one school site, you have 2 and onward to as many as 10 or so forth, that you have greater risk because of those situations. So we have raised those concerns that because of the greater risk, it does seem like in a lot of ways distance learning can work, or it works to some degree. So that is all being looked at, because again, we want to first establish a general schedule, elementary and secondary, and build off of that for all of the different, the SPED, all of the different itinerants, HHS. So it's complicated, but know that we hear your concerns, and we have been continuing to express them.
Thank you, Arlene. And before I hand it off to Jeff, because it seems that our questions are more general, and I do know that we are allowing for Q&A after Jeff's part, I do want to say that in regards to our students with IEPs, who you know, many of you have written in the questions, concerns about their ability, right, to maintain the social distance. All of these concerns will be addressed when we bargain the special ed aspect of our site letter. And we hear you, you know, our special ed committee is one of the great places where people can go. We hear input, but we have been hearing, folks have been emailing us with their concerns. We understand how important it is to offer the free and appropriate public education to our students with disabilities, but also understand the concerns of our members and the safety of our students who have, you know, maybe a little bit more difficulty maintaining the social distance or comprehending all of the different elements that we have to consider when making some of our decisions as we start to take part of, you know, a possible reopening. So with that being said, if Grace can then continue sharing, and I will hand it off to you, Jeff. Thank you.
All right, thank you, Gloria. Let's take a look at this. So, priority. What is a priority? Are schools a priority or a sacrifice? A priority is a fact or condition of being regarded or treated as more important. A sacrifice is an act of giving up something valued for the sake of something else regarded as more important. The priority should have been since March given to the educational and health needs of school-aged children across the county, the state, and the country, especially our highest need students. Instead, what we've seen is card rooms, bars, brew pubs, mini golf, hair salons, museums, racetracks, tattoo parlors, casinos allowed to reopen in LA County, even as schools remain closed. Over the past 7 days alone, there's been an average of 2,372 new cases and 14 deaths per day. And that is a direct result of our priorities. Between 10 and 15% of those cases are connected to sit-down restaurants, bar experiences, and coffee shops. This makes no sense at all. And the numbers will be worse by tomorrow when we all read the paper or watch the news. We as a society have sacrificed our public schools and the children they serve and prioritized instead business interests and the community, the consumer comforts that they serve. Instead of investing in the necessary resources from a planning perspective and a financial perspective for a safe return to in-person learning, we've ignored science, we've catered to privilege, and we've catalyzed community spread to the point where we're almost starting from ground zero like it was March or July. So when elected officials or media or privatization groups ask, when are you going to open schools? We all need to start reframing that question and ask them in turn, when are you going to make it safe to open schools? And that's the question. So on that note, we want to say we appreciate everybody's time for being part of this. We're going to take some more questions, but I want to re-emphasize that last point. It's not about when are we going to open schools. It's when our elected officials, when our community members, when is our society going to make it safe? Because so far they haven't.
Thank you, Jeff. I have a couple of questions that I've been seeing repeated. I was wondering if we can, maybe some of our bargaining members, or maybe Jeff, you, Arlene, can take. So the first one is in regards to the underlying health issues or for folks that are over 65. And then the third part of that is what happens if they themselves don't have an underlying issue, but they care for someone or someone in their immediate family does.
I can take that. Well, one, age is not an underlying, is in the most technical legal sense, age is not an underlying, considered an underlying health condition. And so as we talked about earlier, and Arlene indicated at the beginning, the district is committed to surveying members, our members, and trying to accommodate those who are either unable because of underlying health conditions, or unwilling, or maybe somewhere in between based on family members, anxiety, concern, or other factors, if they do not want to return physically to stay in a remote mode. What we do not know, and we cannot know until families and members are surveyed, is do the numbers match? And the reality is, if there are too many students returning in, and that number far exceeds the number of educators who, for whatever reason, any number of reasons, need to stay out, then that will be a negotiation. There is not a guarantee, and we'll have to negotiate what that looks like. There is not a guarantee that somebody can simply choose to not go back in if schools physically return. And that's just the reality of it. And so that's going to be part of the negotiations moving on.
And then Jeff, can you, or Arlene, or anyone on the safety committee, there's questions. I've got like 5 top questions that I'm seeing repeated. Oh, and also, people are just, there's a reminder here that this session is being recorded, so you'll be able to go back and listen to the Q&A parts, and use this as part of your, if you want to just show it to your staff as well, but you're also getting the PowerPoint delivered. There's also questions here about what happened, what is the protocol if someone at your school site is not following, or I'm sorry, if someone at your school site becomes COVID or is COVID positive. So what happens if we have returned and someone at your school site is COVID positive? Is there a protocol in place by the district, Arlene? Has anyone mentioned the safety committee and what would happen?
Yes, there is, and that's continuing to be developed. But I do want to mention, that there have been things that have changed throughout these months. And it's partly because the science does shift a bit, and the university partners that the district works with have given further recommendations. So for example, at the beginning, we just heard about the testing. You test before you go back in. Makes a lot of sense, right? But then we heard that the district wanted to do baseline testing, and that it would also be able to look at community spread that way. So you give it baseline testing, which I know people felt concerned about and saying, hey, how come now I have to get a baseline test, or why are they asking me to come in? And it is because, again, baseline and then testing before you go in. Now, we're getting questions, if you do not want to go in as a member, or if parents don't want their kids to go in, then again, remember, kids have the option of distance learning. But the district requirement is if you are going back in to be tested, because that is part of the general health protocols that is necessary for safety. So, so if someone is tested positive, again, right now, because things could change, they have stated that they will, again, notify the principal, the school community. They will not get the name of the person, but they will know that there's somebody who tested positive at their school, so that they can get tested themselves and be sure that they're, that they're okay. They will be notified, and then the person will be asked to stay home to quarantine, for 14 days. And also they will have that public dashboard that's available for the public to be able to know where the cases are and how many at every single school. So that hasn't been finalized yet, but that's in the process.
Just to add to that, any positive COVID-19 test is required to be reported to LA County Department of Public Health. And that's why the decentralized nature of the testing and tracing program is something that UTLA is monitoring closely. Because if the LAUSD testing program finds a positive test case, that is supposed to be mandated to be reported to the county. And then at that point, the question becomes, what is the cooperation between the county's contact tracing program and the district's community engagement program, which is what they're calling their version of contact tracing, because the county has been clear, only the county does the true contact tracing. And so, and again, if we think about viral spread, testing and tracing as firefighting, right? That's why first we have to get the level of viral spread or the fire to a level that we can fight it, right? 2, we have to have testing so we can know where the fires are. And 3, we have to have tracing so we can get ahead of the fires. That's why it's we are deeply concerned that the state's rubric for reopening does not take into account the other 2 aspects of pandemic control. And so when there's a positive case at a school site, if viral spread is too high, no amount of testing or tracing is going to let you get ahead of the pandemic, right? In terms of notification, and your contact tracers will be overwhelmed, your testing system will be overwhelmed. We hear a lot about the hospital and the health system getting overwhelmed, but before the hospital and health system gets overwhelmed, we also have to consider the tracing system getting overwhelmed and not being able to get ahead of it. So that's another answer in terms of like what happens when there's a positive case. That's why having low viral spread and testing and tracing capacity and efficacy is so important, because we have to be able to stay ahead of this inferno.
There is also questions. Jeff, were you going to add to that?
I was going to address some of the leave questions. That's okay, Gloria?
Yes, and then can you then go into what happens when our MOU is our current side letter expires?
Yeah, I'll do that one first. We will seek an extension of the current side letter. Certainly at the time when it was negotiated, we could not have predicted that it would expire before people could physically return to school. So we will seek an extension of that agreement. In terms of leaves. First of all, I mean, we're fortunate. I mean, all of our members do have paid sick leave, unlike much of society and much of the economy that surrounds us. That's a good thing, but it doesn't mean folks want to use it up on COVID-related illnesses or leaves. So right now, there is everybody, including educators and our members, get 10 sick days for COVID-related illness that are paid for by the federal government on the initial CARES Act. So those 10 extra days go in front of any accumulated sick days that an employee has from their employer. Now, that hasn't really been applicable for us because most of our folks have not been in that situation because of the remote learning situation. That after the use of those 10 days, you go into your accumulated sick leave. What we don't know right now, and certainly there's a lot of factors that would impact this, would be, not the least of which is a couple of Senate races in Georgia, is there a new CARES Act that extends that extra sick leave that would then benefit potentially some of our members if they get ill in a COVID-related illness. So we don't know if the CARES Act, everybody's probably following the stimulus package that is been attempted to be negotiated with the Trump administration, that has not been enacted or agreed to. That is something that's got to be part of it. Now, if there's not an extension of that emergency sick leave related to COVID, then we'll have to negotiate the rest of that. That'll be a source of negotiation as to whether or not people don't have to use their accumulated leave for COVID-related illnesses. And it will be a difficult negotiation, frankly. Our members do have the 10 plus whatever they accumulate, and then plus the 50% days. All of those would be in play. But we will at the table talk to the district about some type of exemption for COVID-related illnesses, but it's not a guarantee that we win that because that is going to be a difficult bargain.
I'm seeing some questions about the district's testing program in terms of are the district testing sites refusing people with symptoms. When the program started, it was directed for asymptomatic testing, but at this point, it has been supposed to be expanded to include symptomatic as well as asymptomatic testing with contracted nurses doing the symptomatic testing. So hope that helps. And I'm seeing a lot of questions about like, what if, these procedures aren't being followed? So for example, in the testing safety subcommittee, the district has an app where any employee can report problems to maintenance with their HVAC systems. And so we're finding out these avenues where people can immediately report and escalate these situations. And LA County Department of Public Health is also supposed to have a whistleblower hotline and we will also be, obviously once physical return is safe and is about to be underway, that must be publicized, and everybody should have that whistleblower hotline available, as well as avenues within the district to escalate these situations immediately. And again, compliance, we understand compliance is top of mind. We are pushing the district to make sure that all these procedures and protocols are in writing, and that there is a compliance plan in writing, so that when people raise these concerns, they're not just brushed off as, oh, we're going to deal with it on a case-by-case basis. We know that with the pandemic, with the risk, with this life or death situation, case by case does not cut it in these situations.
Thank you for bringing up the whistleblower hotline, Grace. That's been something that's been asked. Grace, I saw that you had a question. There was a question regarding documentation status. I'm sorry, did you already address that? Did you want to address that again?
Yeah, sorry, that was at the top. So Samira is asking parents who are undocumented if you're going to get tested because of their status in this country, how is this being addressed, and how are parents being reassured that they have nothing to fear? I'm really, really glad you asked that, Samira. That's something that we've already raised to the district. both in terms of the testing program and in terms of the app. How is the district going to reassure parents and bring them on board when many of our parents are rightfully, especially after the last 4 years, are rightfully, nervous with given their documentation status. And so that goes to one, making sure that all our materials are translated into the necessary languages, including some indigenous languages, right? Some of our parents do not speak Spanish and speak other languages, and there's documentation issues in multiple communities, right? So one, making sure that all those materials are translated. Two, that HIPAA, as we mentioned multiple times, HIPAA is absolutely maintained in the testing program and in the tracing program. And so, but so much of that is going to be related, frankly, to building trust. And we have emphasized that with the district again and again and again, is that the way you build trust with your parents, with your employees, is through transparency. And so we are constantly pushing them to build trust with the community through transparency and honesty.
Thank you so much, Grace. Okay, and then Jeff, I'm going to hand it over to you. There's questions for clarification you would like to address?
Yeah, just a follow up, and Arlene may be able to join on this one as well. So the 10 days is for isolation if you've been in contact with somebody who tests positive. The 14 days is if you in fact have tested positive. So in terms of the question of do those count, again, going back to the original point, if somebody tested positive or if somebody had to go in isolation because they came in close contact with somebody who tested positive right now, then the first 10 days would be sick days from the federal government under the original CARES Act. As of January 1st, unless there is new legislation, then that would go to the sick days, the accumulated leave days of the employee. Well, that is something we'll address in bargaining. And as indicated earlier, that's going to be a difficult bargaining question. But that's the cutoff is December 31st. The difference is the 10 days is for isolation if you have been in close contact with somebody who's tested positive. The 14 days is the quarantine if you've tested positive. Arlene, did you want to add anything to that?
Not specifically that, but I do want to add that there have been some questions about the budget and whether there should be concerns about layoffs next year and the cost of the PPE equipment and everything that goes into, COVID-19. And someone even did mention, losing Prop 15 as well. And how does that weigh into this? So again, funding has always been an issue and has always been a concern before COVID-19 and now after. We know that the district has spent at least $250 million just on equipment and different things to get, to the free meals that they've been providing and so forth. So yes, money is definitely an issue that we're going to have to continue to fight for, but it's not just the district. It's also going to have to be the city, the state, and the federal government that we're going to be looking to. And so stay tuned because that will be continuing for sure.
Can someone answer? There's two things I want to address that are coming up as of late. One is we understand that we will have to discuss language right around schools that are co-located, but can someone explain how this time, what regulations the charter schools have to follow? Are they different than ours?
Well, they still are on LAUSD campuses. So LAUSD is essentially their landlord. They're in terms of their ability to open, they fall within the county guidelines. So charter schools cannot open, fully open in Los Angeles County right now because Los Angeles County is in the purple tier. At the point if LA County gets out of the purple tier and goes into the red tier, charter schools would be in that same situation. What we're not sure on is where the district lands on co-location schools that are on LAUSD campuses. So we don't have a certain answer on that question at this point.
So I see a question here about the cost of testing, that Mayor Garcetti has said that there is a $5 test per person. So why is there the district using a $20 test? I don't know what Mayor Garcetti said, but my understanding of the situation is that the only $5 test out there right now is an antigen test. And that is not the gold standard of testing. The gold standard of testing is the PCR test. The antigen test, the rapid results antigen test that is cheaper, has a far lower sensitivity rate, and initial results from antigen testing are showing that the sensitivity rate is really not acceptable for asymptomatic populations and infections, which is what we would be concerned about, especially with children under 12, where COVID presentation tends to be asymptomatic. So that's the question in terms of the cost of testing. So I think, are we good?
Gloria, there were a couple of questions earlier about the voluntary service agreements that Arlene referenced early in the presentation. I think it's worth noting that these voluntary service agreements are necessary, first of all, so that we can meet the needs of some of our highest needs students in a very controlled setting. But additionally, from just a purely bargaining standpoint, the district doesn't have to bargain voluntary work. So our attempts at bargaining these voluntary service agreements was to manage what they look like, to ensure that people would not be subject to reprisal if they refuse to participate, that there would be safety procedures in place and protocols in place for when going in and off of campuses in those situations. And again, if those procedures and protocols were not met, that a person could say, I'm done, and walk away because they didn't feel safe any longer as they did when they agreed to do it initially.
Yeah, and those are on our website, so folks can also see like that we made sure that we reference PPE that folks can demand to feel safe, right? That you can say like, look, this is supposed to be provided, have that written language, because Jeff, and as many of you mentioned that, you know, we can bargain the most solid side letter in California or across the country, but enforcement is up to all of us. So with that said, are there any follow-up questions or any last minute things folks want to say before we log off? And again, this will be emailed to you, chapter chair leaders. You will receive an email with a PowerPoint, and then this recording will be available once we edit some of the confusion right before we let all of you on. So once that is gone, you will receive a much cleaner version. Does anyone want to say anything else?
So just to close out, I guess, you know, just to refer back to what Jeff said, it's what we are really facing right now is an existential question about about education and students, whether or not they're going to be a priority or whether they're going to be a sacrifice, especially as cases reopen, as cases rise, as we enter the holiday season. You know, we have to remember that we gather separately today so that we can all gather together in the future. And so I really hope that everybody stays safe, stay socially distanced, wear your mask. And if we all can do this together, and if our elected leaders can do this together, we can do what we need to do as a society to bring our kids back to school. Our kids need each other. Our kids need you. Our kids need their schools. And it's beyond time for our society to prioritize our students so that they can get what they need. And so with your leadership, all of you all on this webinar, please, you know, you'll receive these materials. Hopefully you found this useful. Please share with your colleagues, because as more of us get educated about what it will take to get our students what we need, we'll be able to fight together for it as we fought in 2019 with our strike. So thank you so much, everybody, for attending. And Jeff, close us out.
Well, the period at the end of your fantastic sentence there, which is, let's just remember, when politicians or media or community organizations ask, when are we going back in? Turn it right back around and say, when are you going to make it safe for students and educators to go back in? Because that's the real question.
Yeah.
Thank you all.
Thank you, everybody. Stay safe.
Thanks, everyone.
Thank you to our interpreters.
And our bargaining team members who were typing
Yes.
away quickly. Arlene, are you ending it or should we all just leave?
Yeah, I kind of don't want to do it too soon. Do it because there's still 200 people on. Let's see. So we have a record of all the answers. 241 answered. 231 dismissed.
2,400.
That was great work, you guys. Okay. Should I end this? Just end it? Okay, I'm going to stop the recording first.
Bye, everybody.